Fitzgerald.
Hello.
Sorry, I could not, it didn't give me the option to do a practice room beforehand, so we're just going to go with it.
That's okay.
Hello.
Oh, there she is. This is so exciting.
All right.
Amazing. Oh, okay. I got my questions.
All
Thank you
right.
so much.
Of
Oh, it looks like
course.
people are
Oh,
joining.
wow. Cool.
Incredible stuff. Sorry, I did think I had one extra second. Oh, here it is. Here's the book. But here we are. I guess Stephanie, you just let us know when we can get going. Should we, I guess, wait until six,
I guess,
but we'll
yeah.
just chit chat and hang
Sure.
out until that time. Oh man, this is so awesome. Thank you for doing this.
Of course.
I am such a fangirl of yours. You're just amazing. I can't wait for this. And are you hopefully done working for the day?
Yeah. I finished up like 30 minutes ago and I was like, I don't know that I can make it home, so I think I'm just going to do this from work. So,
Yeah, I mean, perfect. I do that too. And apologies for my wet hair. I was like, oh, I thought I was gonna have time to make it beautiful and lustrous like yours, but I
I
didn't. So
mean,
here we
I
are.
specifically was like, I need to make sure I wash my hair like last night. It was like, no, we're going to be on live tomorrow.
Perfect. This is so fun. So, we'll obviously do intros at six and people get on, but we are going to be talking a little bit, just not too much. I mean, mostly this is informational, but Alicia has been like very graciously agreed to do this live, mostly to talk about well, not just postpartum. I think we focus a lot on postpartum, like prepartum pregnancy and then postpartum issues related to the pelvic floor, which the American Urogynecologic Society cares about quite a bit and has written this like brilliant book, which actually I myself have never been pregnant, so I've never I like needed to like really dig into this. And last night I really read the whole thing pretty much cover to cover
Mhm.
because it's not very long. And my sister just had a baby last week, so I'm gonna give her a copy.
Perfect.
But I learned things like from this book, and I'm a urogynecologist that
I was
I
gonna say, I
didn't know.
appreciated, yeah, it was like a really nice marriage of like things that I'm familiar with as a pelvic floor therapist, but also like kind of
Yes,
getting into the things from like a GYN perspective, a Urogyn perspective that I maybe
totally.
like don't sit in front of a lot. So,
Me too. I like learned some PT things that I'm excited for you to talk about. And I learned things reading this book. There's the diagrams are really awesome. We'll
yeah,
get
I
into them,
marked
but
a
like
couple. Yeah.
this like picture of
Yes.
like how to carry your baby so that your
I
spine is in alignment. I had no idea.
I literally had the same one tab to bring
Yeah,
up because I was just like, I never thought to like put a visual like that, but like
I know.
that's yeah.
Yeah, we'll talk about it. But anyway, it's 6 o'clock.
Okay.
So let's get started. And thank you so much to AUGS for helping to organize this. I'm Dr. Jocelyn Fitzgerald. I'm a urogynecologist and pelvic reconstructive surgeon at McGee Women's Hospital at the University of Pittsburgh School of Medicine. And I am so beyond honored and excited to be doing an Instagram Live with a literal celebrity, the Pelvic Dance Floor, Alicia Jeffrey-Thomas, who has very graciously agreed to do this live. And we're gonna go, I think, well, we didn't decide like how many minutes we're gonna chit chat for, but we're not gonna go more than an hour because
Right.
you can't save a live
Right.
longer than that. So hopefully it won't keep you too long. But anyway, I digress. Thank you so much
Of
for
course.
doing this. And I was sort of hoping just for people who are watching, maybe you could just like give us your own intro, tell us who you are, how you got into pelvic floor PT, and then maybe just a little bit about your journey into TikTok stardom.
Sure. So I've been a physical therapist for 8 years now, which is kind of wild to say, but I have been doing pelvic floor basically that whole time. I was introduced to it really even actually before I got into PT school. I had a mentor in one of the research labs that I was working in who was a pelvic floor therapist. And so it was kind of one of those like, oh, why are you doing a vaginal exam in a research lab? And so I kind of got to have that like
Yeah.
introductory conversation about how pelvic floor rehab fit into the physical therapy spectrum really early on. And so
Awesome.
I ended up seeking out doing a clinical rotation and like really fell in love with it and knew that that was what I wanted to do. So that's what I've been focusing on for the last 8 years. And then I got into social media work like a lot of people did during the pandemic, it was one of those things where all of a sudden I didn't have patience. And so um, it started out as like I just wanted to like stay connected to the people that I had been seeing and like make little tidbits of content, like reminding them about, things that we had gone over in the clinic before things
Yeah,
had kind of, petered out. And then I had something that like accidentally went viral. And so it kind of became this like, oh, now you have a platform that you have to like, really kind of like grow and cultivate. And
maintain.
yeah,
Yeah. What
so
was I don't actually know. What was your first like viral
it
video?
it was the most unhinged thing. It was this like orchestral version of oh gosh, now it's like one of those like overture things. So like boom da 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 da
Yeah,
da, but like
yeah.
I was like swinging through the room on an IV pole talking about like this is what pelvic floor therapy is and like holding up, poop emojis and like uterus plushies and
Yeah.
things like that
I'll
and
take
like
my
stuff
uterus
popping up on the
flushing.
screen.
Yeah.
Yeah, exactly. As
That's what
one
you have
does.
to do. I mean, otherwise it's like, such a obviously sensitive area and people are very embarrassed to talk about the reasons they go to pelvic floor PT, but you make it so normal and fun and like a part of the body that is misunderstood. And I think the visual aspect, I mean, I reached over and grabbed my pelvis, the female pelvis, which we're going to talk about a lot. We have matching
We have the
pelvises.
same ones, although mine is missing a little bit of the superficial layer.
That's so funny. And it's fun because it comes with like, the little organs
Hmm.
inside. But I mean, this is hard for anyone to understand. Like it
Hmm.
is hard for a physical therapist to understand, a MD to understand, medical students. Like I still don't know, like understand the female pelvis. And I have went to 16 years of female pelvis school and that there are things I learn like every single day. It is truly like one of the most complex parts of the body because it's musculoskeletal, it's neurologic, it's hollow organ, it has pain. It literally produces life. Like this can a whole human can be
Yeah.
built from nothing and come through here and then then we kind of have to put it all back together. And it's very hard to understand, so the fact that you are able to make these fun interactive visuals for people to really just say like, yeah, okay, I get it now is huge, because explaining it to people in the office, when I try to explain the surgeries I do, you can just see without a picture, their face is just,
Yeah,
it's
for sure.
stunning. There are people who don't know, that you have 3 holes down there. So let alone
Right.
explain like what's happening deeper inside is impossible without some visuals. So anyway, you're a hero. You are helping so many people. And I'm just looking over at my screen for the questions we were going to discuss, but this can be very organic and we'll answer
Yeah.
some questions if people have them. The goal, though, for today, and someone did say, what was the name of the book? And the book was really just like the inspiration for this Instagram Live. But if anyone would like it, this is it. It's Pelvic Floor Health, Your Guide to Pregnancy and Postpartum Care. It was written by very brilliant evidence-based people via the American Urogynecologic Society, pelvic floor PTs, urogynecologists, I think some PM&R folks,
Hmm.
all got together. I'm gonna actually, the writing group members in the front, yeah,
Yep.
PT, all sorts of specialties and contributors helped make this. And I think it's really an underappreciated little book. It's less than 100 pages long. It's super easy to read. It honestly, you could read it in one night and you're like, oh
Yep.
my God, like I understand this. It would make pregnancy so much less scary, I think, for someone to read this book and then be like, oh, my pelvic floor, like there are actual things. Like I learned about this and now I know what to do, or at least
Right.
where to go get help if I have an injury. So, what do you think before we like sort of start? Like, what are some basics? You're so good at breaking down like basics of the pelvic floor into like, 30-second, 1 minute like videos. So, if you had to make a, a just like little video, like what do you think are some basics that you would want people to
So
understand?
yeah, I mean, I think, the thing that we really want people to understand about the pelvic floor is that that it's there, first of all, right? Um,
Here it is.
here it is. And I think it is really something where knowledge is power.
Hmm.
Understanding, what these muscles are responsible for, that we have the power to kind of take ownership over a lot of these
Yeah.
things. And also, recognizing, okay, maybe these symptoms are really common, but they're not necessarily something that I have to, sit in misery with. There are things that I can be doing during pregnancy as well as
Yeah.
postpartum, so that, we're not like losing out on quality of life.
Yeah,
Um, yeah.
absolutely. I agree. And I think just like, yeah, like the very basic understanding of the anatomy. Like I do honestly like how the sort of like book is set up. It gives you a little intro and it just says like common questions about pelvic floor problems. It's like, what is the pelvic floor?
Yeah.
How common is pelvic floor dysfunction? And I multiple times per my clinic session, I'm sure you as well, like when you have patients in the office, they're like, have you ever seen this before? Thinking they're the only person this has ever been. I was like, ma'am,
Yeah.
did you not see the full waiting room of other women waiting to see me? They all have what you have, which
Right.
is issues with urination, bowel movements, maybe probably organ prolapse, like pressure in the vagina, something feeling it's falling out of the vagina, difficulty having sex, pain with sex, difficulty
Hmm.
have urinating. Like those are all things. Anything that like happens between your legs that is suddenly not easy or comfortable is what your pelvic floor is doing. So
Right.
I think people just don't know there are physical therapists and physicians and healthcare providers that specialize in all of that, which is crazy because there's so many parts of it.
Right. And I think it's like some of it comes down to like, we think about childbirth as like, oh, this is something that, women have been doing for generations, right? Like
Yeah.
people give birth in fields
In
and so you should
fields.
be fine. Yeah.
Yeah.
And it's like, well, also maternal mortality was not great back then either.
Right.
You know what I mean? Like they're like it's like, no, we can adapt to the knowledge that we have
Correct.
now and give people solutions.
I know. I always say like the irony is that the reason we have all these pelvic floor disorders because humans have such big brains, which means they have
Hmm.
big heads, which have to like we've created our own problem
Right.
because our brains are so big and our pelvises are small, and so you can absolutely have injuries. And yeah, maternal morbidity when we talk about it, I think often is spoken of in terms of like cardiovascular health or
Hmm.
other like diabetes, other things, bleeding that happen intrapartum, but maternal morbidity includes urinary issues, prolapse, pain after you have a baby. I know so many women that develop chronic pelvic floor instability, pelvic girdle pain, back pain, and after pregnancy, and like it kind of never gets it isn't better because they haven't done anything to treat it. They just kind of like live with it, and then they get their whole life back
Right.
by going to see you. I mean, it's just amazing how long people live with this. They're like, oh, I had a baby, and I guess suffering is just part of the female
Right.
experience, and here I am.
Right.
So, anyway, I couldn't agree more. Um, I think I see maybe let's see, living with the aftermath. Oh, we're going to talk about this a little bit. A question
Mm-hmm.
about OASIS, for those who don't know, is an obstetric anal sphincter tear, fecal incontinence, and people talking about being able to compensate before menopause. And then, yeah, when women go through menopause, they do lose some of like the compensatory mechanisms that help with their muscles, and there's so much about that we still don't understand, but um we'll sort of dive into that actually. So
Sure.
do you think, I'm curious, I like wrote down this question as a pelvic floor therapist, do you think that everyone that has a baby should go to pelvic floor PT after they have a
I
baby?
in an ideal world, yes. And so I
Yeah,
think like the answer to this is that it should be offered to
I think so
everybody, right? Because
too.
there's so many things that are happening in the postpartum
Yeah,
period, but if it's not mentioned that like, hey, if you're having these issues, here is the service that can help with this.
yeah,
Like a lot of people aren't going to know to go down that rabbit hole. Whether you choose to partake in it at that point or later down the line, fine. But like I
sure.
think knowledge is like a huge piece of that.
Agreed. I tell people like even just go to like one session, get to know them, establish yourself as a patient so
Hmm.
that even if you are one of the many lucky women, who do, they have a very straightforward delivery and they feel great, like they aren't having incontinence, they're not having pain. Fine, wonderful. You just went to one session.
Right.
That's all. But then if you're not one of those people and you're like, "Oh my goodness, like I really feel better." The way that it kind of works, I think most places in the US, and this is basically true at my hospital, is people who do have like an obstetric anal sphincter injury or some sort of more severe laceration absolutely are referred to our specialty clinic. It's called Mom Clinic. Dr. Lauren Jagali runs it at my hospital, and then they universally are referred to PT. Um, what is your approach like in someone who has an anal sphincter injury? And I'm going to get the picture from the book to show,
Oh,
but
sure.
when someone comes to you postpartum, like what do you work on with them? What does that look like, the session?
Right. I mean, so the session in general, right? It starts out with a lot of talking. So
Yeah.
we really go through, we get a really thorough history, and if somebody comes in, they say, "Hey, I had this, anal sphincter injury." Okay, I'm also asking about, in addition to asking about like, okay, now what's happening with your bowels, what's happening with pain around that region, I'm
Yeah.
also then asking, what's happened with your bladder or what's happened with, anything else kind of in that surrounding region. I kind of always refer to this as the theory of stuff. Like there's only so much room in the pelvis for all the stuff to coexist. So
Yeah,
everything affects everything else. Um,
exactly.
and
Big.
then, from an exam standpoint, right, we look at everything head to toe. My exam always starts very globally. How is your body moving? What's happening with your hips, your core, all of that stuff. And then
Mhm.
depending on that person's comfort level, we decide whether we're going to do a pelvic floor muscle evaluation.
Yeah.
Um, and then specifically, right, if they're dealing with more kind of anorectal issues, we may opt to do a rectal exam. Usually I'll default to a vaginal exam, at least on the first visit,
Yeah.
just because people are generally more comfortable with that. And we can get a little bit of the lay of the land
Right.
to kind of know what direction we want to go with things.
I agree. And I think a lot of my patients are scared. They're like, "Oh my God, they're gonna like put their finger like do vaginal manipulation like right away." And I'm like, I can't speak for all pelvic floor therapists, but I will say that most of they're not all female, but a lot of women in pelvic floor PT, I would say mostly,
Yeah.
go into this because they are very trauma informed. They're very passionate about the subject, and they really are trying to change the status quo with like how
Mm-hmm.
we approach exams in this way that maybe you've had trauma, maybe not, but it's they're in general so wonderful. Like every pelvic floor therapist I know, I'm like, don't worry, they're gonna talk to you first. They might not even examine you. Like it really might just
Right.
be about breathing today. Like
Right.
you might,
Exactly.
yeah, just go through like your birth history. I did find the picture. I like should have bookmarked it, but really briefly, for anyone who's curious, again, for anyone who's just tuned in, we're referencing pictures from the Pelvic Floor Health book that was written by by AUGS, the American Urogynecologic Society, and on page 29, they have a nice, well, I know visual. Hopefully, Instagram doesn't shut us down for showing vagina
We're gonna get
pictures.
banned from the live.
I
it's
know,
a it's a it's a drawing. It's not an actual
I
image.
know. One time I actually did. Do you think I did a live that I was like questionably I think kicked off of because they didn't like how often we were using the word vagina. But hopefully that doesn't happen today. But this
Great.
picture is very informative and I think very very helpful because it goes through the range of like perineal tears that go from a first degree tear, which is just the skin, a second degree tear, which is like the perineum, which is between the vagina and the rectum, like really just tears like to here. Here's the vagina, here's the rectum. And then the more severe tears, like a third degree tear, goes into the external anal sphincter, which is this red donut of muscle. And then a fourth degree tear goes into the internal anal sphincter. And there's sometimes those can be complicated to repair, and sometimes people do develop fecal incontinence, sometimes not. Um, there's definitely considerations for like the next delivery, like
Totally.
there are some patients who are like, you know what, I don't really, that was pretty awful, and I don't really want to risk that happening again, especially because maybe I healed well and I'm nervous that I might not heal as well if this happened a second time,
Hmm.
and they do opt for a C-section. I mean, it's really like a conversation that you have to have
Totally.
with your OB, but it is a recommendation of the American College of Obstetricians and Gynecologists that if you had a third or fourth degree tear, I see someone here mentioning how they had a fourth degree median tear in forceps. Forceps are probably the biggest culprit, unfortunately, for those. We can talk about forceps a little bit. I would love to talk about forceps actually. Um, anyway, but the recommendation is that you at least be offered a C-section if that's what you want.
Yeah.
Oh, and I agree. The AUGS just made a comment. For those of you, there is an awesome website, Voices for Pelvic Floor Disorders, which is voicesforpfd.org, has a lot of like
Mm-hmm.
really, really nice graphics that have been made. In general, there's just not enough, I think, like visual teaching aids
Yeah,
for the
for
pelvic
sure.
floor.
I
for whatever
I will
reason.
say there is another if you've ever looked at Tracy Scher's images
Yes,
on like Pelvic Guru, she has like an awesome library of stuff that just really goes through like the whole gamut
yes,
of, you know,
she does.
PT more related things, but she does a really good job there too.
Yeah, you're right. She is fantastic. Maybe we'll get her on here someday. But I like you make more dancing videos than her. Yes. Okay, so I guess since we're on, that subject, we actually were just talking about women who had C-sections.
Mhm.
What do you do, what do you think about pelvic floor PT after someone's had a C-section? Like, how would you approach that differently from someone who's had a vaginal delivery, for example?
Sure. So, I certainly don't like just because you had a C-section doesn't mean that there's nothing going on with your pelvic
Yes.
floor. You still had a whole, 9+ months of stuff weighing down onto your pelvic floor. It's been working
Yep.
overtime. You had postural changes that happened.
Yeah.
And so you're recovering from all of those things and all of those changes, in addition to major abdominal surgery, right?
Right.
So we're layering in all of the things that we would do in a regular pelvic floor muscle evaluation to make sure that all of that is doing okay.
Uh-huh.
But then we're also specifically looking at how the scar is healing, making sure that that scar is nice and mobile, and making sure that that's not impacting their ability to kind of reconnect with their core muscles.
Yeah.
I see a lot of people post C-section who have a hard time, like, if they're lying on their back trying to like pick up a leg and like march because it's like that whole,
Mm.
connecting there. They do these really weird things to like get their legs up and over like a bolster up over the
Yeah.
edge of the bed. So there's little muscle patterns that certainly change. We want to make sure that we
Totally.
kind of get those reconnected and smoothed back out. And then also just dealing with any, pain complaints around the scar or around anything like that.
Oh, that's so interesting. I absolutely I don't know if she's watching, but my sister literally just had a C-section like last week, and I've been talking to her, and she's saying how like her back really hurts, because she can't engage her core
Right.
like at all, and I'm certain that her gait is different because she's trying to like protect her incision, and
Mm-hmm.
she's also trying to carry a baby,
Yep.
and I was like, you need to go to PT, like if nothing else, just to kind of like figure out like what is going on. Like people think of also the pelvic floor, but they forget like your legs are attached
Yeah.
to your like right here. Here's your legs. Like these are your hip bones. And here is like your lower back and your SI joints. Like these things physically separate. Like
Right.
they come apart when you're pregnant in preparation for a whole human head to come through here. So even if you haven't had a vaginal delivery, I mean, the remodeling that takes place and the changes and like the differences in exactly your core strength and your gait can absolutely, I see all the time, like set off new aches, pains, instability, other places. So it's not all about incontinence. Sometimes it's literally just about walking,
Right.
dancing. Hopefully they get back
Dancing.
to,
Right.
yeah,
Exactly.
dancing is the goal. Um, Anyway, I also think, I mean, this is very interesting. We have a sort of comment about how if something happens, I see a lot of patients, yes, who are like not just immediately postpartum, but like are
For
decades
sure.
out,
For sure.
And I mean, yes, fecal incontinence is a really hard problem to treat, no question. Like bowel control is a very complex musculo-neurologic process. But there are things that absolutely like can be done. Like how do you, if I may, like how do you approach like a fecal incontinence
Yeah.
patient?
I mean, so first of all, we want to figure out like when the fecal incontinence is happening, right? Like, is this something where it's, specifically just a like muscular, like, okay, like things aren't the doors aren't closing appropriately,
Yeah,
or is there some kind of like underlying constipation where then there's almost like a like overflow fecal incontinence
yeah,
happening? Like that's where I'm saying like we do a lot of talking and trying to figure out, what do your daily routines look like? What do your habits look like? When is this occurring?
hmm,
Because just the symptom of fecal incontinence is not necessarily enough. Like I need to
sure,
know more.
yeah,
If it is just a strengthening thing, we start with pelvic floor muscle training. We build up, strategies for like, is there an urge associated with that feeling like you're going to poop your pants, right? And so we
yeah,
talk about, urge strategies to make sure that you can get where you need to go. Different things like behavioral strategies like that. So
yeah. Agree. And I always talk to people about, there's like a GI component to this too, like a dietary component, like
Hmm.
a stool consistency component. And then, there are things we can do as urogyns. Like, I think a lot of people often have questions about surgery. Like, is there
Yeah.
something surgical you can do for fecal incontinence? A lot of people ask questions about like sphincteroplasty or like some
Hmm.
some actual surgery there. And that's a really interesting question because nowadays, like, we know that most sphincteroplasty is honestly better to be done like if you have a tear that's like surgically separated, like in the postpartum
Hmm.
sort of time point, and later on it's more of a like cosmetic fix than it is a functional
Mm.
fix.
Hmm.
Especially like decades and decades out, we're more inclined to try like a neurostimulating device like sacral neuromodulation, which is a little tiny wire that we put like in the back, like
Yep.
down here in S3. And then you do a trial period of it for a week or two to see if it helps you. And you keep a little bowel diary. And if it
Hmm.
does help, then we put a little battery in your butt cheek, which is kind of great. But a lot of people ask me that. They're like, oh, can I have, yeah, exactly, like a sphincteroplasty, however many years later. And the irony, I guess, of that and sort of upsetting to a lot of patients is that the complication rate for that is super
Hmm.
high, and especially decades out. Like if it comes apart immediately postpartum, absolutely, like we're putting your anal sphincter back together, no question. But if it's something that doesn't heal very well and decades have gone by, the amount of like viable tissue that's there compared to like the risk of infection is just really not
Yeah.
work. You could wind up in a much worse off place than before we operated. So sometimes we just have
Interesting.
to say no, which makes patients upset. But there are things we can try. I always tell them like bulk your stool. Like
Yep.
if your stool is not liquid, the chances of you having an accident is so much lower. Like
Hmm.
you want to just take a fiber supplement, get enough fiber in your diet, like have one good bowel movement per day is the goal,
Right.
so that you can get there in time. Anyway, I digress.
No, that was
But
good.
that's
Because
a
like
big
fecal incontinence
thing.
is one of those things. It's like I think somebody said it's like as common as asthma, but it's like not talked about nearly as much.
Yeah,
That's one of the ones that people really tend to suffer in silence with. And
very much
so
so.
totally, I'm yeah.
Yeah. And it starts, yeah, like I mean, we're gonna talking a little bit about birth and especially around like an operative delivery, like vacuum or forceps, like those things have their role obstetrically. I
Hmm.
guess maybe I do want to spend a moment talking about that. Like
Yeah.
there are scenarios in obstetrics where it is appropriate to use the vacuum or forceps to get a baby out.
Hmm.
That being said, I personally, as a urogynecologist and as an OB/GYN who delivered babies as a resident, don't really think that the awareness around like pelvic floor health and operative delivery is
Right.
sufficient. Nor do I think like the counseling about it beforehand is sufficient.
Right.
I think there is really this attitude that people are almost doctors are nervous, I think, to bring it up because first of all, it's like not super common you have to use it, but if you do,
Right.
the chances that you're going to have a sphincter laceration are not insignificant. Like they're fairly high, like 10-20%.
Yeah.
And those really bad vaginal lacerations are almost always from forceps. And they can cause some really like almost irreversible damage sometimes, like a real lifelong struggle. And people don't talk about that enough. I just don't think the consent process is universally appropriate. I think there needs to be a lot more discussion when patients come in and are consenting for delivery. It needs to be said, like, these are the maternal risks. In my
Right.
opinion, the risks really focus around the baby, like what can
Hmm.
happen to the baby's head or the baby's face or the eyes, or bleeding. Like, it's rarely around, like, we're
What is
going to
happening
put
to the
what is
birthing person's
happening.
body?
Yes.
Yeah.
We're putting, like, these metal spoons that are the size of, like, a baby's head into your vagina and pulling. And, like, that can cause some really bad lacerations. So, going back to fecal incontinence, it can start, right after delivery, like reproductive age, and
Yeah.
it keeps. I mean, nothing will keep you like locked in your house, like being worried you're gonna poop your pants out in
Yep.
public,
For
and it just
sure.
slowly, like, just takes and takes and takes from your life. Like you stop you're like, I'm not gonna go running or exercising. Like, what if I poop myself? I
Yep.
might not want to work out like outside my house, and a lot of people are
Hmm.
virtual, obviously, but you're gonna like there's things you're gonna slowly turn down that you don't realize, social events, other obligations, church,
Yep.
and you're like, I just don't know if I want to risk it. Next thing you know, like you're isolated, you're not really exercising, and it has this just detrimental effect on your health from top to bottom. So yeah, go like see someone early.
Absolutely. For sure. 100%. I second all of that. Like it's so
It's so
important.
sad. Yeah, it's such an embarrassing problem. And, you know, I think a lot of people are like, oh, what can you do to prevent this? And I would love to know what you think about that. People often say, like, should I be going to pelvic floor PT when I'm pregnant or before I even get pregnant, or if I'm thinking about it? What are your thoughts on like preventive physical therapy?
You know, I think that we live in such an educational vacuum in our society
Yeah.
that like if somebody wants to come to pelvic PT before they ever even think about getting pregnant, I'm all for
Yeah.
it because I want them to like even if it's like come in and like let's learn about your body and like
Yeah.
how things are right now because there's so many people who have a baby and they look down at their vulva for the first time postpartum and they're like, what the heck is going on?
Yeah.
And it's like, okay, yes, there are probably things that look different, but also how much were you looking at that before? Like how much were you really in tune with how things were functioning
Yeah.
before? So I think having that awareness level, doing some preventative stuff, learning kind of what's good and bad to be doing for you and your body individually, like I think that's
Yeah.
awesome.
I agree. I mean, the book actually does go through this a little bit. And like, I even, you know, when people ask me this, like, oh, should I go to PT when I'm pregnant so that I prevent like a tear or I prevent other things? Unfortunately, pelvic floor PT hasn't really been shown to necessarily prevent a tear because that's too independent of like
Sure.
many other things, like
So
how
many
big the
things.
baby is, how big its head is, like what's happening. But it has been shown to prevent some things, like it says in the book, like it has been shown to prevent like stress urinary incontinence, for example. Like there is something to learning how to engage those muscles. And I think really as an educational tool, pelvic floor PTs take a long time to get in with. You're all very in very high demand. But if
Yeah.
you can get in, I think when you're pregnant, it really doesn't hurt at all to
No.
learn more about your body.
Yeah.
If a patient came to me while they were pregnant and were like, can I just make an appointment for you to teach me about my pelvic floor? I would love that. I'd be like, okay, because
Yeah.
I am an OBGYN. I can talk to you about operative delivery, like from an evidence-based perspective. I can talk to you about what we can do postpartum. What are the risks of getting prolapse, of having incontinence, of having an anal sphincter tear? Um, and then, you know, that's like the easiest appointment in the world for me. I love
Right.
that. I'd be like,
Yeah.
oh,
That's
blessings.
fun.
Because
Yeah.
I don't want to also blame like obstetricians for this. Like obstetricians, pregnancy is insane. They have to counsel you about so many things in like a really short visit. And then for us to say like, oh, they didn't really bring awareness to pelvic floor, like, yeah, I mean, we could all do better at a lot of things, but even though this book is short and it's easy to read, it is still 90 87 pages long.
Hmm.
So, you know, there's a lot to say about the pelvic floor that you can't really learn in your OB's office. That's why we have a whole
Slew of
whole fields of
resources. Yeah.
medicine, yeah,
Yeah.
dedicated to this. PT, Urogyne, like it can't all fit in an OB visit. So
For sure.
hopefully we will empower some people listening to just like come see us. We'd love to see you. Be an easy day for us, you
Yeah.
know, to teach you about your body. Let's see what else we wanted to talk about. Anything you wanted to chat about while we have a few minutes? I know that your time is very
Good,
valuable, and we
good
need you to keep
question.
making cool videos for us to watch.
Um, can we talk a little bit about like I think we put this on the list, but like talking about, you know, kind of the Kegel centricity of pelvic floor
Yes.
therapy.
Yes.
Uh,
Let's do that.
so it's kind of one of those things where I feel like you know, if you know anything about the pelvic floor, right, your
Yeah.
brain goes Kegel,
Kegel.
right? And it's I explain it as if we thought that everything that had to do with the pelvic floor was just Kegels, it'd be like if everything to do with every shoulder problem was just do more bicep curls, right?
Right.
It's a little bit reductive to say like, oh, that's all you have to do and like, or that's all you can do,
Yeah.
and you'll be, um, you know, we certainly kind of look at pelvic floor muscle function as a spectrum. So
Mhm.
you want to be able to contract, you also need to be able to relax at the right times. And I will say, like, anecdotally, in my experience, people tend to have more of an issue with the relaxation piece, and that affects how they're able to contract.
Yeah.
So
Absolutely.
making sure that people have a good understanding of kind of that whole spectrum of pelvic floor function, and then also how it layers in with everything else. And I think we kind of already talked about that a little bit about everything else that's included in a pelvic PT exam.
Yeah,
But just making sure that people know that like you're not just going and you're not just going to be told to do Kegels. Like it's going to be
absolutely.
more than that. And also, not everybody needs to be doing Kegels. There are people where,
Right.
that's maybe
The
not what the focus
opposite.
needs to be. Yeah, especially if you're
Yeah.
having pain, especially if you're, if you tend to be, even just at baseline, if you're somebody that knows that you tend to be more of a tense person, like you clench your jaw or you find yourself like holding in your stomach all the time, like you might be one of those people that needs to focus more on relaxation first.
Absolutely. I have so many patients like, oh, I don't think I want to go to pelvic PT. I've already tried the Kegels. I'm like, that is not what they are going to do. I mean, they're going to help you strengthen and they're going to help you locate these muscles and like kind of figure out how you can control them. There's not just one muscle down here. But I think a lot of people don't realize how important the relaxation phase is to the contracting phase.
Yes, absolutely.
If I could send anyone home with like one message, that would be it. Like have
Yeah.
someone help you. Like when you weightlift, you don't just like curl, curl, curl. Like you have to
From
like
here to here.
extend.
Exactly. Full range of
Exactly.
motion.
Full range of motion. I should use the word range of motion more when I'm in my office. I'm going to do that. I really never say that. I'm like, you need to go learn pelvic floor range of motion. They're going to look at me like I'm
Like what?
crazy, but but I'm gonna say that because I agree. Like the Kegel, as you said, its centricity is bananas. Like
Yeah.
it doesn't help anyone.
I
Um,
do want to look at this person that commented on here about
yes,
using like a
that is
peri-fit or like an at-home
exactly
internal.
what I was gonna
Yeah.
say too.
So basically anything that falls under that category, right, where you're putting something into the vaginal or anal canal that is transmitting feedback of what's happening to your muscles to a screen, that's biofeedback.
Hmm.
And so that's something that pelvic floor therapists have used in the clinic for a really long period of time. Some
Yeah,
people have moved away from using that in the clinic, but what's nice about these devices is that they do, empower people to have that visual feedback at home. And some of them are, kind of gamified where,
yeah.
it's like instead of, oh, I need to squeeze, I need to relax, it's like, I need to play Flappy Bird and get Bird to go over the thing. So that makes it kind of fun. I'm hoping that this technology just continues to improve
Yeah.
and evolve over time because I do feel like it's, sometimes we'll miss those hypertonic folks that don't
Hmm.
necessarily need to be doing Kegels. Like
Yeah.
it's only measuring where you're starting at baseline and it's assuming that that's zero, but it could be somebody else's 20,
Exactly.
Um, so I will recommend them to patients or I'll
Mhm.
validate their wanting to purchase one after I've, done an evaluation and seen what their muscles are doing. But that's usually kind of the way that I tend to talk about it is like with when somebody's already cleared your pelvic floor and make sure that you have a basic good understanding of how to contract your pelvic floor, then we, get you on one of those
I
devices.
agree. And I've, there's some nicely done studies that for someone with like fairly straightforward stress urinary incontinence, fine. Like
Yep.
absolutely. Like if you are busy, you don't maybe have access to a pelvic floor physical therapist. I mean, there's not so many like urogyns and pelvic floor physical therapists. So I don't want to get on our horse on this Instagram live being like, it's so easy, just go. I mean, some people don't have access to it. So
Right.
I'm definitely not looking down my nose at anyone who tries those devices whatsoever. I know that you're obviously
No.
not either. Like, go for it. But the research shows mostly they're helpful for stress
Right.
incontinence.
Yep.
And I also, same thing. I say, like, if you're gonna get it, like, take it with you. Take it to the pelvic floor PT evaluation. They might be able to give you like an evaluation, and maybe they're gonna. I mean, correct me if I'm wrong, but most of the pelvic floor PTs I know, they know
Mm-hmm.
that like postpartum women or like young mothers are so busy. Like coming
Yeah.
to PT once a week or twice a week might not be possible. They might be able to give you a regimen that's, works around your
Mm-hmm.
lifestyle and the amount of time you can dedicate. Maybe they'll use this device and show you how to use it. Same
Yeah.
thing with like the people who are hypertonic. I'm like, they're going to teach you how to use the wands and
Right.
dilators, like all the other tools. That's part of the beauty of them.
Exactly. We always have that individual conversation about like what does your ability to commit to this and do this look like,
Mhm.
right? And
Yeah.
so if there's somebody who, needs to be more independent because of the distance that they drive to my clinic or
Yeah.
that they, have childcare issues or whatever,
Sure.
we talk about like what their options are, and that can include, devices and things like that.
Yeah. No, devices are great. They're a tool, I think, in our kit. But
Hmm.
thus far, we have not created an AI pelvic floor therapist. So I think having the relationship piece and the trust is a very big part of it as well. The
Totally.
validation, like you all do, I call it like gynecology in like the very best way possible. Like so much of this is like wrapped up in people have a lot of feelings around their pelvic floor
Hmm.
and what it's been
Hmm.
through. And I mean, I'm just so grateful to all of you for being such good listeners in addition to being so knowledgeable about anatomy and function. So I'm like, just go. They're so great. Like they're gonna make your life better. I love
Exactly.
pelvic floor PT. What would I do? And yes, I agree. Pelvic floor PT are so important with the in capital letters. So important. Um, let's see what else. I don't want to we were at like sort of 30, 40 minutes. I know you stayed from work and we're so grateful. Um, let's see. What else do we want to chit chat about? Anything else? Let's just maybe just wrap up by saying like anything else we want to highlight from the book. At the beginning, I talked
Mm.
about how my favorite thing was were these images about how to like
Yes.
lift
Hmm.
postpartum, like how to lift a box. It kind of walks you through that and how to like hold your baby so that your spine isn't this red squiggle, but more a straight straight up and down, which is easier said than done, but proper lifting technique and proper carrying technique. I thought that was super interesting. I'll be sending that to my sister
Well, because so many people don't
tonight.
think about that, right?
Yeah.
Because they're like, well, I'm right-handed, so I need my right hand free. So my baby's always on my left. So I'm always kind of shifted over here so I can
Hmm.
free up this right side.
Yeah.
And, then it's like, we talk about like, all right, like how can we make sure that we're a little bit more stacked, or at least that we're
Yeah.
switching sides, right?
Yeah.
To kind of
Right.
like even ourselves out a little bit.
Totally.
Um, but no, generally, I think like the visuals in this book are like beautifully
Yeah.
done. And even like things that I wouldn't think to like explain to a patient. So like talking about like, the size of your uterus after childbirth and like how it shrinks
I,
down over time.
yes.
Like I
I
thought that
love
was
that.
so interesting.
So interesting.
Um,
I've actually never in all of my OB-GYN training like ever seen a picture like this where they
yeah,
actually show how big your uterus is and then it shrinks. Like
right.
I know that because I have felt a uterus that size,
Hmm.
obviously, but I've never really seen it illustrated that way. And I was like, this is so nice. This pessary
With the
is of a
pessary.
pessary.
Yeah, yeah, yeah. I had
Yeah,
that one
where a
open too. Yeah.
pessary fits. This isn't like for prolapse and has an incontinence knob on
Hmm.
it. And I think a lot of people just like don't understand like where pessary is going, where it's fitting.
Hmm.
It's changing a little bit as more people are comfortable with like menstrual cups and
Totally.
things, but
Yeah.
a lot of patients just do not understand. They're like, is that going to get lost inside of me? Like, what is going to happen? What do I do? Do I take it in and out myself? So I think that goes through that really nicely. I mean, yeah, the illustrator who did this was 10 out of 10. Like, I
Yeah.
love it.
Like yeah,
Yeah,
top tier. This is great. I
totally.
also really like in this book the way that, especially towards the end, I think it's chapter 7,
Yeah,
they kind of do like almost like a hierarchy of like, if you're having this problem, like you can go to pelvic PT, you could then look into, a pessary, then you could look into this, like surgery. And so it like
yeah,
kind of lays out like, here's what your options are for all of these things in kind of like order of operations, least to
yes,
most invasive, right? I thought that
totally.
was really nicely laid out because I feel like, people need to know what their
Yeah,
options are. They need to,
yeah,
have a good understanding so that they can make informed decisions. I thought this did a really good job here.
I agree. I also like love the language. It's like so empowering. Like it says like having a baby is a major accomplishment for your body. And I was like, ah, it is a
It
major accomplishment. That
is.
is so cool. It's like it's reasonable. This process will create some changes. So give yourself some credit. And then it says good news. Women have powerful healing abilities. Most changes are temporary, which is true.
That's great.
And talks about how having a baby is a big deal, and a lot of these things are common but not normal. If you have pain, discomfort, it's just like
Right.
a really delightful little
It
book.
is.
So anyway, I hope it will help people. I mean, it was made like not for really making money or anything, just because nothing like this really exists. There isn't
Right.
really like a pelvic floor health book that's made by experts. Again, I learned so much about like back posture, like posture in pregnancy, and then like pelvic girdle pain and like how it's
Hmm.
distributed. The difference between pelvic girdle pain and sciatica. I did not know that.
That was really
Um,
interesting. It was like the teeny tiny
yeah,
percent of people with like sciatic type symptoms that actually have sciatica versus how much of
totally.
this is just pelvic girdle
I
pain.
know.
And like I guess I see that clinically, but I'm always thinking like, well, maybe there is some sciatic
Maybe it
piece
is
to it. But I guess,
sciatica.
you know,
Yeah, only 1% of women actually have a sciatic nerve problem in pregnancy, and almost all of it is pelvic girdle. And that makes sense, but everyone just says, sciatica, sciatica. And unfortunately, sciatica is also one of those things that's kind of like an orthopedic problem.
hmm,
And I mean, again, no shade towards orthopedics, but an orthopedist, if you're pregnant, is not touching you. So yeah, pelvic floor PT is kind of like your go-to move for
right.
that. So that was really cool. Oh, and it says, where can people get the book? The book is available. It's available on Amazon and is available on the AUGS website. So
Yeah.
go get it. Give it to your pregnant friends. They will be so happy to have it. Or your non-pregnant friend.
Just
Whoever
a
you think.
person that might be
Yeah,
thinking about or has had a baby. I think
totally.
it's again like it's so like
Very
concise.
concise.
You know,
How to
it's
find a pelvic floor therapist. So useful.
hmm,
Resources for finding a pelvic floor PT. So, oh yeah, exercise and its effect on delivery. That's really cool. Kegels, how to assess your support. It goes through all the anatomy. I just think it would alleviate a lot of anxiety in a lot of people. And we do know in Eurogyne land that addressing these problems earlier does help your outcomes. So even if like let's say decades down the line, you're the kind of person who like needs prolapse surgery. If you have prolapse surgery at like a earlier phase of your symptoms, if like PT hasn't, cut it or like a pessary isn't for you, we know that like your tissue is healthier when we do that surgery, you're going to heal better and you're going to have a better outcome. And the women who come to us and have that success, usually it's because they've heard of pelvic floor PT or urogynecology. And the reason that their delay is decades and their prolapse gets bigger and bigger and their tissue quality gets worse and worse is because they simply have never heard of us.
right.
And something like this will like let people know what a Eurogyne is. And I guess I'll just one of the last things I want to say is I think a big reason that people don't know about urogynecology and pelvic floor PT is because we'd have to then admit as a society why we need those fields of medicine, like why we have to exist.
Yeah,
And people don't love, thinking about birth as something that isn't perfect and
right.
beautiful. Um, but it's not always perfect and beautiful, and babies are great and parenthood is great, but like we need to take care of moms, and
Yes.
we need to admit that sometimes they need help, and there are these really really high in demand large fields of physical therapy and surgery that are built solely around problems that childbirth can create. So step one, tell your
Yeah.
friends.
Step, tell all your friends.
Tell your
Exactly.
friends. So anyway, anything else you want to say before we wave goodbye to
No, I
people?
mean, I think this was really great. I
Yeah.
like I said, like I think you're right. Like the more that we can talk about these things and get the word out and get people talking to their friends, like I think it's just I'm really curious to see where like our generation is when we get
Yes.
to that like, postmenopausal age. Like what are our
Yeah.
pelvic floors looking like now that we're having this like kind of, you know,
Yeah.
increase in awareness happening. Like I'm really hoping that that's translating to, improved kind of quality of life for everybody down the line.
Yeah. I think that it will. I think the difference between like I'm a millennial, like
Yeah,
my generation, and millennials are like largely postpartum. I mean, millennials are getting,
true. We're
we're
getting
into
up
our
there.
40s. We're close. So like millennials are postpartum. I mean, I think it will be so much better. Like my mom, first of all, my mom had 8 vaginal deliveries, bless her heart. I'm the oldest of 8 kids, which is a
Whoa.
big reason I'm really interested in pelvic floor health. She
Yeah,
actually has shockingly good pelvic floor health. I hope she's okay with me
sweet.
saying that on an Instagram live, but I think she would be.
It's better than
Um,
you saying my mom has a really
yeah,
bad pelvic floor.
no, she has her pelvic floor is like should be studied. But anyway, like it made me very interested in it, but she had nothing.
Hmm.
Absolutely nothing. There's no social media, no way of like building awareness around this. People are definitely not talking about incontinence, prolapse, pain, tissue integrity. I like what someone said about offering HRT. We didn't talk to that about that today,
Hmm.
but see a urogynecologist. We'll talk to you about vaginal estrogen and some other things.
Okay.
And that's pretty much it. The
Cool.
title of the book is in the comments, but I'll show it one more time. Pelvic Floor Health, Your Guide to Pregnancy and Postpartum Care, written by a really dedicated and delightful group of people via the American Urogynecologic Society that includes PTs and MDs. So grab it
Yeah.
if you want.
Right.
Anyway, thank you for joining us. I guess we'll sort of like bid you adieu, but until next time,
All right. Thanks so much for having me
you're
on.
the best. Talk to you later.
Bye.
Bye.